Okay, good evening, everyone. If you can hear me, good evening, good evening. We will be starting shortly. We're just going to give a couple more seconds for people to join. People are still joining and jumping up on the call. Welcome to this evening's event. As much as possible, if we can stay on mute so that we can hear our speakers for tonight, that would be great. And if you have any questions going on in the program today, please type your questions in the chat window and we will be looking at your questions and answering your questions on there. But so good to see you all. While we're waiting for everyone to join, if you can just type in the window. I know today is Friday evening and everybody usually does different things on a Friday, but if you can just type in the chat window, what's your favorite thing to do on a Friday evening? Lockdown or no lockdown? Let's just begin to type that in the window and let everyone see. And while we're waiting to still admit a few more people, what's your favorite thing to do on a Friday evening? Let us know, just throw that in the chat and let us see that. Nice. Ola likes a family meal. Billy Sugar likes a family movie. Netflix. Wow, Netflix is interesting. Noemi loves pizza. Netflix and football. Nice, nice, nice. Okay, let's have some more. While we're waiting for a few more people to join. What's your favorite thing to do on a Friday evening? Lisa likes movies and popcorn. Movies are winning on the Friday evening. Okay, great. Another movie night. I like some family time. Oh, we have an Andrew Lloyd Webber fan here. I don't know if you noticed, Andrew Lloyd Webber has been doing this this thing on YouTube where he just goes through quite a few of his musicals. I love Andrew Lloyd Webber, by the way. Lovely, lovely. Fuller likes playing games. Ooh, Kirsten likes watching nature programs. Nice. Okay, good stuff, good stuff. Okay, great. So it's good to see you all here this evening. And thanks for joining on the call. I'm going to be handing over to Dr. Noemi in a minute. But before I do, I'll just introduce myself. My name is Olaolu Okwebi, and I'm one of the founders of Sickle Cell Awareness UK. And so one of the reasons why we have set up this charity is to create awareness around sickle cell. Now, if you are about my age, and some people think I'm like 25 or something, but I'm way on in years. You would know that sickle cell was something that was discovered around the time of our parents' generation, or my parents' generation, and it wasn't something that we knew at the time. A lot of our parents didn't know anything about it, and so through their various relationships, we ended up with quite a number of children with a sickle cell disease. But as time has gone on, a lot of awareness research has gone on, and we now know more about the disease, sickle cell, and there's much that we can do to help out with the sickle cell disease. So what if in our generation or in our children's generation, we can actually eliminate sickle cell? So that's the question I'll ask. What if we can actually do that? The World Health Organization published statistics that says approximately 5% of the world population have a trait of a hemoglobin disorder, which includes sickle cell. So that means about 350 million people worldwide are carriers of a trait of sickle cell. Every year, we know that about 300,000 babies are born with the sickle cell disease. Again, these are all statistics revealed by the World Health Organization, most of whom are African, Caribbean, Asian, or from African descent. And unlike any other disease which can be contracted externally, this particular disease happens when two people that are carriers come together and then they have a child with a sickle cell disease. So if we can put out the information there, if we can put out the awareness there, then we can do much to help to reduce the condition of sickle cell in children and to eliminate that probably in a generation. And it is possible, and that's one of the things that Sickle Cell Awareness UK is looking to do. What we want to do is to provide a lot of education, awareness, enlightenment about sickle cell, but we also want to do it in an entertaining manner, in an entertaining way as well. Sometimes the statistics and the information out there is just cold, but we want to make it engaging, we want to make it lively, we want to let people know that there is hope, that there is much that we can do. Also, we're going to be making grants at some point to support charities that are actually doing a lot of work for Sickle Cell UK. One of the things that we're hoping to do is to be able to actually provide genotype testing kits to regions, countries that are most affected by this disease, where possibly they don't have enough of these type of kits, to create enough awareness within those regions to let people know that if you're a carrier, you need to make better choices. We want to also fund more research around the sickle cell disease. And finally, we want to engage with corporate organizations to raise the awareness within corporate organizations, encouraging them to do more on their diversity agenda for those that are carriers of sickle cell. Again, as I mentioned, it's mostly people from a BAME background, so Black, Asian background, that are affected by the sickle cell. So there's much that organizations can do, especially here in the UK, to support from that perspective. So this is what the charity aims to achieve. And if anything that we've said ignites your passion and you're interested in helping us out, we need all the hands we can get. We need all the help we can get. We need all the champions that we can get to help us to raise the awareness of sickle cell. We're not replacing other charities that exist as at today, but we're trying to raise the awareness. You know, I talk to people about this from time to time, and some people don't even know that we even have a charity like the Sickle Cell Society in the UK. Some people are totally unaware of that. So we want to raise the awareness on all fronts, let people know what's happening in terms of sickle cell. So that's just a brief introduction of what this charity is all about. And now I am going to hand over to Dr. Noemi. She has some good information for us. Dr. Noemi is a consultant hematologist at the University of Oxford. We've been working with her for over a year now. We got to meet her through a mutual friend who is also part of the charity last year. And we put on an event last year, and we're working again together this year. She also is part of a charity called CAN, and they are also doing a lot of work for sickle cell in the UK. So I will hand over to Dr. Noemi as she takes us further tonight. Welcome, Dr. Noemi.
Thank you very much. Can you hear me? I've just unmuted myself. Hopefully you can hear me. Thank you very much, Ola. Now, my only concern from your introduction was you said you like to give information in an entertaining way. I absolutely haven't planned a stand-up routine, so I'm really sorry if you're all hoping for a comic this evening, a comedian. That is not what you've got. You've only got me. So I haven't actually prepared a talk because I thought the best thing really, especially in this time, this quite scary and unusual and weird time for us all, we don't really want to be hearing like a lecture, and I think a conversation is the way to go. So some of you will have sent in some questions, which I've got here, and I've reorganized all the questions to fit in little themes. And if you've got other questions, or while I'm talking, something's not clear, then just type it into the chat and we can try, either I'll notice it, or Ola or one of the other co-hosts can let me know. Also, somebody will need to tell me when it's time to stop talking. Ola, you'll just have to tell me. I can just go on and on. So thank you everybody for joining. It's the kind of thing where, you know, it's Friday night, and usually before coronavirus, you'd kind of, if you were planning anything on a Friday night, you'd be thinking, oh, I better check who's free. And unfortunately, nowadays, everybody's free on Friday night, because everybody's free every night, because everybody's just at home. And it's a really strange feeling, and it's scary. And I've spent today doing some clinic. They're all been outreach clinics, so I've just been seeing people from on a video. And it's been quite interesting, because some people have found that they feel really happy with lockdown. So myself, I feel really happy with lockdown. Some of the patients feel really happy with lockdown because everything's slowed down and you've got time and permission to calm down and think about things and do things in a different way. And you don't have to be so busy. And then some people are feeling really bored, and some people are feeling really anxious, and some people are feeling really desperate to get out. And I think we've got to really admit to ourselves and to each other that we're all different, and there's no right or wrong way to go through this thing that we're going through now. And whatever you're feeling is fine, and whatever you're going through, you know, all the questions you're having, and whether you're finding it easy or hard, or happy or sad or whatever, there's no right or wrong. So I just wanted to start with that. So I'm going to start with some of the questions that people have sent in, and I've decided to start with all the questions about shielding. So I'm gonna grasp the nettle. I'm gonna really grab the bull by the horns, because I think that's almost the hardest question to answer right now. And again, interestingly, shielding, so it's a word I think probably none of us ever really thought about before coronavirus. I mean, if you mentioned the word shield, you would have thought about, I don't know, gladiators or knights or something. But shielding is something we've become familiar with. And it basically means, if you look at what the doctors are expecting people to be doing if they're shielding, it basically means you're in your room and you don't go out at all, and you don't mix with anybody, and you don't share a bathroom, and you don't share a kitchen, and you just have nothing to do with anybody for the whole time that you're shielding. So very, very, very few people are actually shielding, okay? Because it's, first of all, extremely difficult to do. Not many of us are in a situation where we can actually be in a room on our own and have our own toilet and our own kitchen away from everyone else in the house. And it's also, you know, it's a bit like solitary confinement. So as time has gone, what we found is that some people still have stayed at home, even though they're not necessarily locked in a room. Some people have just not gone outside at all in the whole time since the lockdown, whereas other people are going out every day, okay? And again, there's no right or wrong. There's nothing magical, there's nothing superstitious, there's nothing, it's not because you've gone out once that you've sort of broken the rule and therefore bad things will happen. No, you might stay indoors all the time and go out once and catch coronavirus, or you might be somebody who goes out every day and not catch coronavirus, okay? So a lot of what all of us are having to go through and to think through is probability. What's the chance that this will happen? How do I weigh things up? How do I weigh up the risk that I'm taking? What kind of a risk am I taking? And we're all waiting to find out what's going to be the advice about whether the shielding is going to continue or finish, okay? And at the moment, it's been extended to the end of June. But again, I've spoken to people today who are planning to go back to work soon. They're not going to wait for the shielding to finish, okay? And I've also spoken to people today who, even if the shielding were to finish at the end of June, they still wouldn't go out. And I think at the end of the day, it's got to be your decision. And your doctors are there, your medical team are there to help you make that decision, okay? To help you talk through the risks. So we're probably going to be in a situation where individual people, you're going to think about what's your risk to yourself, what's happening with your family, and what's happening with your work. So for example, if I look at the questions people have sent in, one person's asked about SC. So I've got hemoglobin SC and I rarely have any crises. So should I be shielding? And could the coronavirus trigger a crisis? So at the moment, we have said that everybody who has any kind of sickle cell disease, including SC, even people who never have a crisis, we are considering them to be just as much risk as other SS or people who have a lot of crises. And you might say, well, that was the decision that was taken at the beginning of the lockdown when we didn't have any information, any data. But what about now? Because you must have more information now. And we do have more information because we've been looking, all the hospitals in the UK, we have a system for talking together. And once a week, we're talking with doctors from all the different regions in the UK. And we're collecting all the data to see how many patients with sickle cell disease have had coronavirus. And it's about between 150 and 200 patients in the whole of the UK. Okay, so so then you would say, well, what's happened to them, and is it better if you've got SC? And the answer is SC seem to be at risk like SS. So whereas for a lot of things in sickle cell, we're saying that SC is a milder disease, even that isn't always right. You're still at risk of coronavirus, and you're still at risk of severe coronavirus. So having SC doesn't really protect you. So should you be shielding if you've got SC? The answer is yes. But when the end of the shielding comes, SC and SS will be in the same situation about releasing from shielding, okay? And I think what's going to happen is each person is going to have to speak to their medical team about their own risk. Now, one of the questions was about returning to work if you work in a care environment. And again, today we've spoken to a patient who works in a school. So obviously, let's say you're going back to work to do something in an office, you're going to be at less risk than someone who's going back to work in a hospital. And you're going to have to talk to your employers and see, okay, I'll come back to work, but is there something I should be doing that's not the same as my usual job? So let's say you work in a school and you're usually in a classroom with 30 children. Well, maybe if you talk to your employer and you say, well, I've got additional risks when I come back to work, maybe I could just be doing one-to-one with the kids, and I'll be somebody who helps them to listen to their reading or something like that. Okay, so I think that's the way we're going to come out of lockdown, come out of shielding. It's not going to be you've been shielding for 12 weeks, now you open your front door and you walk out and go back to your life you had before, not straight away. It's going to be a slower coming out, and each person is going to assess what is the safe thing for them. Okay? So someone specifically asked me what steps will be taken from June the 15th, and the answer is I don't know. I can't tell you that. But what I can tell you is that the guidance that's going to come out will be guidance that we'll have decided. We're a group of about 40 doctors from around the UK making these decisions, and we're talking to each other and we're analyzing the data and we're having discussions and we're listening to each other so that we can try and make the best conclusions possible and the safest thing possible. Okay. There's one question about sickle cell trait, and there was a lot of confusion about that early on with coronavirus, but having sickle cell trait does not put you at risk. Okay, so if you're SS or SC and you've got children who are trait, or parents or siblings or whatever, they are just like anyone else in the general population. They're not at increased risk. So having a trait is not an extra risk. So there's a question, it's not specifically about shielding, but it's kind of like, it's saying that now that the kids are at home, what can you do to manage them well? My own is so restless and wakes until very late, like 2 a.m. And I have to say, it is really, really difficult. Some of it is difficult because, you know, they're used to going outside, they're used to running around, they spend a lot of energy, right? So if you're a small child and you're used to spending lots of energy and suddenly you're cooped up indoors, all that energy still has to be spent, okay? And it's got to go somewhere. So it's partly about finding things they can do inside to really get rid of the energy, whether it's jumping jacks or, you know, all sorts of games you can play indoors. And part of it is, I mean, I think kids are really good at picking up our anxieties, aren't they? And our anxieties, sometimes we don't have to express them. We don't have to say them out loud, what we're thinking. We don't have to, you know, we don't even necessarily have to be shouting at them. And I say this as a mother who does shout at her children from time to time. But sometimes the kids, they just pick up our anxiety that we feel inside. And I think that part of that restlessness that they have will reflect that. And I think one way, if you're looking to try and help them become less restless, one way is to really, really have a routine that they stick to and that they know the routine, because I think also children, if they know what to expect, it's easier for them. So, you know, this at this time we're doing this, at this time we're doing that. And also there's lots of, I can't go into a lot of detail at the moment, but there's lots of really nice ways of doing winding down, relaxation, and even very young children can get involved. So we can do, if you've got more questions about that, just send an email and then I can send you some sites about that. Okay, I'm gonna cover symptoms next. So there's lots of interesting questions about symptoms. So one question says the WHO has defined more symptoms compared to what the NHS is advising. Body pains was added as a symptom for COVID-19. Considering sickle cell patients who experience body pains, does having body pains and headaches only signal you may have COVID-19? I think the answer to that is we don't know. Okay, so we're learning about this virus as we go, and there's lots of different symptoms. Like, for example, the loss of taste and loss of smell. At the beginning, people weren't too sure that this was really coronavirus, whereas now it's become one of the symptoms. So the body pains is very difficult with sickle cell disease because you will be getting pains anyways. Is it possible that you've had what you thought was just a crisis and turns out to have been coronavirus? Yes, it's possible. And someone has asked a question as well about the antibody tests. So they're not available quite yet, but they're really very nearly available. And once they become available, it will be possible. It won't be possible for everyone to have them straight away, but eventually it will be possible for everyone to have them. And you'll be able to find out if you had it or not. And for example, they were talking on the BBC yesterday about how in London, 17% of the population have had the coronavirus, okay, from the antibody test, whereas in the rest of the country it's 5%. It's entirely possible that some of you have had it, and yet you didn't necessarily think you had it, okay? So one of the questions is the same one. How long could the symptom for body pain last, and could you have coronavirus and not know? Yes, absolutely. If someone has a nasal drip, should they be tested for coronavirus? That's a difficult one because you essentially, I think what you have to do is if you've got any symptoms from coronavirus, you contact your medical team, okay? And I think as doctors, we think we've been very clear to all our patients about the fact that if you think you've got coronavirus, you should not stay home and not tell anyone. You should absolutely contact your medical team. And if it's the weekend or the night and you can't get hold of your medical team, you should go to hospital. You should go to A&E, because two reasons for this. One is that you may not have coronavirus, you may have a bacterial infection. And that bacterial infection, you could die of a bacterial infection if you've got sickle cell disease and you're not on antibiotics and you haven't presented to hospital, okay? Because when you've got sickle cell disease, your spleen doesn't work. So it's very important to come to hospital in case it's not coronavirus. And we are absolutely want to reassure people that if you come to hospital, you will be safe. Now, everybody's very worried about attending hospital and catching coronavirus. You don't want to be having your crisis and then coming to hospital with a crisis and then end up with coronavirus. But what we're doing in the hospitals, and this is the case for every hospital, people who could have coronavirus go in one area and people who are coming for something else go in a different area. Even if you're coming in with a fever and you turn out not to have coronavirus, you will be isolated, so you wouldn't be catching it from anyone. And as soon as we know you don't have coronavirus, you get moved to the other ward that doesn't have coronavirus, okay? So it is very important, and it scares me when I hear that people have stayed home with a fever. And we know of a case, at least one case in London, of somebody who didn't come to hospital and they died of a bacterial infection, okay? I see somebody's asked the question, are all sickle cell patients with coronavirus critically ill? Absolutely not, absolutely not. Some people with coronavirus and sickle cell are managed at home. Some of them come into hospital and don't go to intensive care. Some of them do go into intensive care. And if you do go to intensive care, then the risk of death is much higher. And that's true whether or not you have sickle cell disease. But the vast majority of people who got sickle cell and coronavirus have recovered and gone home. Okay, so that's really, really important. And some of them haven't even come to hospital. They've just been managed at home. Does the coronavirus affect liver and kidneys as well? Yes, absolutely. Everybody with coronavirus can get severe complications, and that can affect your liver, but mostly your kidneys. Are you more likely to have that if you've got sickle cell disease? We don't have enough data to say yet, okay? Is it possible that coronavirus could have been around before December 2019? Really interesting question. I don't know the answer. It probably wasn't here. It started in China around that time. So I think if you were ill before December 2019, it's unlikely that you've had coronavirus. Okay, next section is about going back to work, going back to school. I've touched on that a little bit. So one person says, I'm SC and with school starting back on the 1st of June, isn't it risky for me to send my kids back to school? Will I be putting myself at risk? Really interesting question. Spoke to a patient today who said she's not sending her children to school on the 1st of June because she's way too worried about them coming back and her getting coronavirus from her children. But I think the guidance that we're going to put out will say that it's safe for your children to go back to school and then to come home, even though you've got sickle cell disease. Now, the most important thing is going to be hand hygiene, okay? So for your children, when they go to school, to wash their hands, and I think the schools are going to be so conscious of that, whether or not there's anyone with sickle cell disease at home. The children are going to be washing their hands. They're going to be in smaller groups. They're going to be not in their school uniforms. When they come home, they're going to be, when your children come home, you want them to take their clothes off and you want to put the clothes in the washing machine and wash it straight away. Have them wash their hands. I always say, I kind of always wash my face as well, because I'm a person who, I touch my face a lot. So I have kind of face cloths at the sink, so that when I come home from work, I wash my hands and I wash my face. So it's going to be that kind of thing. If you are so anxious about sending your children to school and you just don't want to send them to school on June the 1st, then I believe that you will have the right to say that, okay? It's worth speaking to the school, it's worth speaking to the teachers, and maybe you just want to wait 2 weeks and wait and see what happens once other people's children go back to school, and that is fine. You know, I think again we've got to forgive ourselves for the feelings that we have at the moment. We've got to I can't think of the right word, but to be permissive. So the advice may be, yes, send your children to school, but if you don't want to and you don't feel safe, then don't, and see what happens. Wait a week, wait 2 weeks, etc. There's also a question about nurseries, and I think that would be the same for nurseries. Now, obviously, nursery children, the younger they are, the more they're going to touch everything, touch everyone, put their hands to their mouths. At the moment, we don't think that it's unsafe to send them. And the other thing I want to add is, you know, I was saying we've got this group of about 40 doctors that are meeting every week and discussing all this. If suddenly it looks like it's not safe, we will announce that very quickly, okay? I don't know how you've been keeping yourselves informed. You can find out, I'll speak to Sickle Cell Awareness afterwards about how they're sending out the information, but we've got lots of ways of sending out that information and making sure you've got the most up-to-date information. And it's on the Sickle Cell Society website. We've got an Oxford website. There's the British Society of Haematology. So we could send that. I'll ask Sickle Cell Awareness to email everybody with all those links afterwards. So my point is, if things are looking unsafe, within 3 days of sending children back to school, we will update our advice within 3 days, okay? We're gonna be very vigilant about that. So then there's lots of questions. I wasn't ignoring you. Somebody earlier, Andrew Pemberton, asking about vitamin D. I wasn't ignoring you. I was just waiting to come to the bit because lots of people have asked about that, okay? So lots of people have asked about vitamin D, vitamin C, vitamin B12, or any other vitamins. So vitamin D has been in the news a lot because it's been shown that people who've had more severe coronavirus have lower levels of vitamin D. And we haven't done that yet for sickle patients. And part of the reason we haven't looked at for sickle patients is because once you start to put everybody's data together, it becomes more like a research study, right? And to do a research study, you need to have ethics. So we have to apply to ethics to be allowed to put this data together. So at the moment, all we've done is look at really basic data. Have people had a swab? Is it positive or negative? Did they go to intensive care? Did they recover? All of those questions. So we haven't looked at vitamin D yet, but in the general population, they have looked at vitamin D. So people are asking, should I take vitamin D? And I would say, yes, please take vitamin D, okay? You should be taking vitamin D anyways if you've got sickle cell disease, unless you've got really good levels of vitamin D. And I know, I can think of 3 patients of mine who've got really good levels of vitamin D, and they all take cod liver oil, usually the capsules. So if you don't want to take vitamin D, take cod liver oil, even better. But basically, you should be taking that anyways for your bones if you've got sickle cell disease, because almost everybody in the UK is deficient in vitamin D, certainly in the winter. I wouldn't go, I don't think you need to go to your GP for a prescription. You can take it over the counter. Now, some of you who've seen me in clinic will be thinking, what is she talking about? She always tells us not to get it over the counter. And it's true that if we've checked your level and it's low, to really get it up into a good level, I always say to people to take the vitamin D from the GP. But at the moment, the GPs, not every GP is seeing patients. It's a bit of a mess. So for now, just get from the chemist vitamin D tablets, the normal over-the-counter ones. Vitamin C. Does that help to fight coronavirus? Nobody's looked at that. Is vitamin C good for fighting off infections? Yes. So should you take it? Sure. It's not as clear. I'm not going to say everybody go and get some vitamin C, but I don't know, if you're at the chemist and you're buying your vitamin D and there's vitamin C as well, you can buy it. Or just drink some orange juice, okay? You can get vitamin C from orange juice. You can get it from kiwis. You can get it from Ribena. So you don't have to take a tablet. The vitamin D is harder to get from your diet. You've got to be eating oily fish, mackerel, salmon, things like that. What about vitamin B12? No reason to think that there's any worry with vitamin B12, okay? If you are normally low in vitamin B12, you should be taking it. But and we test everybody once a year for vitamin B12. So if no one's ever told you you're low in vitamin B12, I wouldn't worry about that. Okay, that's that one. Someone's asked, oh yeah, that's the same question about antibody testing. That's fine. Blood transfusions. Okay, so there's one question. First question is, are exchange transfusions still safe in this pandemic? And there's 2 things there. One is it safe to go to the hospital for your procedure? And the other one is it safe to have somebody else's blood? So we'll take those separately. First of all, is it safe to go to the hospital? we are very, very, very careful about people coming into hospital. Okay, so we're wearing masks and gloves and pinafores. We're staggering appointments to make sure people are not next to each other in the waiting room. If any of you have been to the hospital recently, you will be shocked because you've never seen a hospital so empty. Okay, everything is done extra carefully. So is it safe to come? Yes, absolutely, it's safe to come for blood transfusions. Is the blood safe? And the answer is, as far as we know, the blood is safe. Okay, so out of all the people who've had coronavirus, who've been in this pandemic, there's not been a single case that we know of where someone's caught it from a blood transfusion. Okay, now normally we're always very careful that our donors are healthy. So when they arrive to give blood, this is even without coronavirus, they get asked, is it okay, you know, have you been well, how's your temperature, etc. And if they've not been well, if they've had a bit of a cold, they just get sent home. If they've got any symptom, if they've got no symptoms and they give blood, we actually don't use their blood straight away. So we have to test for lots of things. We test for HIV, hepatitis, all those things we would normally test for. Except this time, we also keep the blood for 5 days, even if all the tests are done. And then that gives time for people, if they were in the process of developing coronavirus, if they become unwell in those 5 days and they ring us up, we just throw their blood away. Okay, we don't ask questions. If anybody becomes unwell, we just throw their blood away. Can I promise that no one is ever going to catch coronavirus on a blood transfusion? No, I can't promise that. I don't know that. Okay. That it's that each unit won't have it. So there's a question about why can't you test for coronavirus? So I think that the answer to that question is there wouldn't be enough coronavirus in the blood unit that it would show up positive on the test. Okay, but I don't know. That's a really good question, and I will ask people from the NHS blood and transplant unit. So I'm going to write this down. Why can't you test for coronavirus in the blood units? And then I will tell Sickle Cell Awareness and they can send it out, because we're going to do a little Q&A afterwards anyways. I'll do a little summary of everything we discussed, so we'll put that in, but it's a good question. Okay, so one of the other questions is similar. What happens if I receive blood from someone who is or was tested positive for coronavirus? So I've kind of answered that already. Now, what if it's someone who's had coronavirus? What if somebody had coronavirus and now they've got antibodies and then they go and give blood? It's possible that actually you would be protected from getting coronavirus, right? Because you'd have the antibodies. And in fact, there's a trial at the moment where it's called convalescent plasma. So they take people who've had coronavirus, have been discharged from hospitals, they take their blood, spin it in the machine, but instead of keeping the red blood cells, they keep the serum. So they give the patient, not the patient, well, the person, they give the person back their own red blood cells, and then they keep the antibodies. And they are giving the antibodies to people in intensive care now who are sick with coronavirus. So that trial is happening now. We don't know if it's going to work. It's in process. There's a question, if you've recently had an exchange blood transfusion, should you be worried? No, absolutely not. I would not be worried if I've just had an exchange blood transfusion. We are encouraging people to come for their transfusions because we do not think that people are going to get coronavirus from a transfusion. Okay, so we're not worried about that. The other thing is people might worry about, are they going to run out of blood? And actually, we're not running out of blood. We have plenty of blood. And this is because we've cancelled all operations that are not emergencies. So actually, we've got loads of blood because most of the blood we use for operations. And then these are all the questions that I've had on specifically coronavirus. There's one question about, I developed an antibody from a red cell exchange. What does this mean for my health? So this has nothing to do with coronavirus, but I'm happy to explain it. Essentially, when we match blood, we match ABO, like are you B, A, AB, or O, and we match the rhesus, are you positive or negative? Because those are the most serious antibodies. With sickle cell disease, we match actually a few others as well, but there's up to 200. We have up to 200 blood groups. So we only match the most common ones. And what happens with developing an antibody, it means that you've received the blood from someone that you don't match their group. You match their group for like the big important ones, but there's one of those 200 blood groups where you didn't match. And so you've developed this antibody against them. So what does it mean for your health? It means that
very important to both of you.
receive the same.
Oh.
Somebody needs to mute. Don't know who it is. If you were to develop an antibody, if you were to be given more blood of that blood group, you would destroy that blood. Okay, it wouldn't harm you, but you would destroy that blood, so it wouldn't be of any use to you. So it means that when you're coming in for a cross match, it's a pain for you because it means we can't cross match you on the same day. It means you have to come in the day before for the cross match, but it means we have to match you extra hard. So it's harder and it takes longer to find blood for you. And then the last question that people have sent in, and I see there's a few others coming through the chat, is are sicklers at greater risk of developing arthritis? It's hard to answer because I'm not sure what you mean by arthritis, but with sickle cell disease, you are more likely to develop joint problems, and that's because especially the hip joints and to a certain extent the shoulder joints, those joints can, some of the bones in those joints can basically die off because of being damaged by sickle cell disease, and then that's very, very painful. It's called avascular necrosis, and then people need a joint replacement. Is there a link with other types of arthritis? Well, we know of a few patients who've got sickle cell disease and rheumatoid arthritis, but I'm not sure if that's what you were asking. Okay, so I'll take two more questions from the chat. The trials for the antibodies, will the vulnerable people get it first? Good question, Fola. I don't think that they're doing it that way. I guess the other way around to think about it is if you've got sickle cell disease, are you excluded from the trial? And the answer is no. So you have access to the trial, same as anyone else. Okay, so how would you access it? You'd have to be going in a hospital that's running the trial. So for example, Oxford. So if you were coming to Oxford, you would be offered the trial. If you were going to intensive care and if you were one of those patients who had the more severe end of coronavirus, whether they would, I don't think they're in a situation where they've got one vial of the drug left and there's one person with sickle and one without sickle, and so they have to decide. It's not like that. The trial is ongoing, and if you've got sickle cell disease and you're in intensive care and you fit all the criteria, you would have access to it. I know you put starting new patients on hydroxyurea on hold. When will this be resumed? I'm waiting to begin this treatment. So that's a question from Sola. Really good question. I think we're pretty sure, we're pretty happy to start that fairly soon. So if you want to speak to your doctor about that now, I think certainly if it was me, I'd be happy to start it. At the beginning, we were very nervous, okay? We were very nervous about bringing people up to hospital. We were very nervous about giving anyone any drugs that made them more likely to, because one of the problems with hydroxyurea is your white blood cells will go down. We're now much more relaxed because it seems, all our patients on hydroxyurea have been absolutely fine. So I would say that could be started soon. For healthcare workers, nurses, pharmacists, etc., in view of shielding, when will these individuals be able to resume their normal working duties as their roles are patient facing? So that's a really excellent question. And essentially, the way I'm going to answer it is you're going to be the last group that we will advise to come out of shielding. Okay, so we're first going to advise for people who are not put at risk of being exposed to patients like that. Having said that, it's going to be a case-by-case basis. Okay, so if your role is actually going to be in an office most of the time where you're going to be able to socially distance, and then when you go to see the patient, it's a limited interaction and you're not going to do any procedures and you can wear a mask and etc., and you're there for 15 minutes maximum, then, you know, that sounds fine. Whereas compared to someone who you're actually going to be at the bedside the whole day, and you're going to be washing people or doing a procedure, I don't know, like if you're an anesthetist and you're putting a tube down somebody's throat. So on a case-by-case basis, we will review that. If you want me to answer for everybody in healthcare, then yes, you will be the last that we were going to advise to come out of shielding. And somebody did ask about being a student nurse and going to a placement. So again, there will be there'll be student nursing roles that you can do where you're not going to be at such a high risk. So it's going to be a question of you know, talking to your course organizers, and you can involve your doctors, you can involve your nurses to, you know, be your advocate and discuss it with you. But essentially, it will be, I think by September, I expect some people will be in patient-facing roles. Okay. What are the outcomes from the 200 sickle cell patients known to contract the virus? Okay, $1 million question, isn't it? I was hoping nobody's going to ask that. No, I'm kidding. So it's not actually 200 patients with sickle cell disease. It's 200 patients with inherited anemia. So we've got sickle cell disease, we've got thalassemia, we've got rare anemias. Okay, the majority of them are sickle cell disease. So the outcome is most of them recover. So 92% of them are completely fine. The death rate was 8 out of 100. Okay, now what's difficult, it's very difficult to talk about death rates because it's essentially, so if you look at that data we've put together, it won't take into account everybody who's had it. Okay, so there'll be plenty of people who've had coronavirus and been at home, and they won't be counted because their doctors won't know that they've had it. Okay, so again, I spoke to a patient today who said, oh yes, back in March I wasn't well 5 days, described all the symptoms. I was like, well, you've had coronavirus. Okay, so people like that won't be counted in this. So that 8% is 8% of the people that we know about, and that includes all the people that we know about that were very severe and ended up going to intensive care. Okay, so the vast majority of people have recovered. 8% is higher than the rate of people without sickle cell or any other inherited anemic case. So this is why it's hard to talk about these numbers, okay? Because are you really comparing like with like? What do you mean by, what is the rate for people without sickle cell? Do we know that? I mean, you know, there's all sorts of numbers that have come out in the press about what the death rate is. But your question is, when you're talking about death rate, is what's your denominator? What are you comparing against? Okay, so if you go, there's a website called Worldometer. I had a look, and it tells you all the positive cases in every country in the world, all the positive cases in the UK, and all the deaths. And if you divide the deaths by all the positive cases, you actually get 14%. So compared to that, the 8% is lower. Okay, so I'm not a statistician. It's very difficult to do these comparisons. The thing that's important is, one, most people recover. Two, we've had no deaths in children with sickle cell disease or any other inherited anemia. Okay, so children in the general population do well if they get sickle cell disease, if they get coronavirus. Same thing with sickle cell. So this is why we're relaxed about children going back to school. Why does the virus have a higher death impact on BAME communities? We really don't know. There's lots of different hypotheses. You know, is it genetics? Is it environment? Is it, you know, so I think I said earlier about how in London, 17% of the population have had coronavirus compared to 5% in the rest of the country. Is it the fact that most people with from an ethnic minority background live in London? Is that what the impact is? We don't know. So is it a good time to have your gallbladder removed? I would say no. Okay, at the moment, we're still not doing any elective operations. If you come in with your appendicitis and you need your appendix removed, you can be sure we'll take it out. If you need your gallbladder removed because you've got gallstones and you've had infections before and we've told you you need your gallbladder out, we won't do it now. Okay, so we're still not doing any elective surgery. How come those on the continents themselves don't seem to be suffering at a higher rate? Kafui, that's a very good question. And now we're going to get into politics and, you know, were all the right decisions made here? Did they make better decisions elsewhere? I heard something really interesting about it. Again, it's statistics, but it was about how if we'd gone into lockdown only 1 week earlier, the number of lives that would have been saved, all of those things. There's no question that when we come out of lockdown, when people start mixing again, the rate's going to go up. Okay, the coronavirus hasn't disappeared. The rate's going to go up. It's all about you as an individual, what you're doing, the risks you're taking, and the precautions you're taking so that you can resume as normal and good a life. And it's not just about having a good life, right? I mean, a lot of people, they need to get back to work so they can earn some money. I mean, this is just natural. This is just the way things have to be. So, but it's about all the changes that have to be made so that you can minimize that risk for yourself. We've reached the end of the questions, unless I've missed any, in which case, please retype it, or can one of the co-hosts read them out? Because I think I've tried to keep up with the different questions. Does anybody else have any other questions, or we can unmute people if that's easier? I don't know what you guys want to do.
That's really fantastic, Dr. Noemi. I think you've tracked and spoken to all the questions tonight.
Okay.
So unless there are more questions on the line, if anyone else has any questions. Oh no, that has really been amazing and very enlightening, Dr. Noemi. Thank you so much. Thank you so much for sharing all of that with us. And like you said, you will share with us more information and more links.
Yeah.
We can email to everyone. So that's really great. Okay, and
oh, there's another one.
One question come up.
Travel. My God, we all want to travel. So I like the fact it's later down the line. Later down the line, fine, no problem. The question is, you know, when is later down the line? There's gonna be guidance about different countries, and then it'll also be about what your reason for traveling is. Okay, so let's say you've got to go abroad because you haven't seen your family for years, or let's say you've got to go for a family event or something like that, versus you just want to sun yourself on the beach. I think it'll be about making those decisions about how important that travel is to you, but also then what you're going to do. You know, how are you going to get to the airport? You don't want to go on public transport. Can someone drop you off? When you're in the airport, wear gloves and a mask. When you're in the airplane, actually the air in the airplane is fine because it's recycled. So you know how people with bone marrow transplants, they go into this room and the air is filtered. The air that is in the airplane is filtered more often than in a bone marrow transplant room. So you know that's essentially what you're going to be talking about. We used to travel carefree. We will have to travel more thoughtfully and carefully. That's what it's going to be about. Yeah, returning to work for some people means taking public transport. Is this safe? I would really worry about public transport, and I think it's going to be a question of finding out from your employer what the options are. Because the other thing is, it depends as well. If you think about it, let's say you could get to work on a bus, but you'd be taking the bus, you know, if you could take the bus at 10 a.m. and 3 p.m., you could avoid the rush, and you'd wear your gloves and you'd wear your mask. and you could sit by yourself in your seat. Well, that might be all right. So it's about, will your employer let you work 10 a.m. till 3 p.m. at work and do the rest at home? Or do you want to do, I don't know, 6 a.m. till midday or something like that? So it's going to be those kinds of questions. Or is there someone from your work who could take you and you could do carpooling? It's going to be, we're going to have to look at every one of these cases one by one. Shielding only till June, will it be extended? I think not. The guidance is not out yet, but I think we're going to be going towards relaxation. But like I said, if everything shoots up again, we're going to immediately say, no, you have to go back to shielding. So we are going to be watching things live. Can an SS patient who's a healthcare worker go on to work, and what's the lifespan of an SS? I don't quite know what you mean by the lifespan of an SS, but going back to work as an SS patient, again, we're going to have to take it case by case, speak to your employer. Can your duties be limited so that you're as safe as possible? I live in Nigeria. Numbers are steadily on the rise, but lockdown's been relaxed considerably. I'm worried about dropping our guards because my wife has sickle cell, so we don't want to take chances. Are we overreacting? I don't think you're overreacting. It's very hard for me to say what's going on in other countries, but I think you do have to be careful. And I guess the question is, how reliable is the information, right? So if you're being told the number of cases is dropping, who's doing the testing, how reliable is it, etc. So keep your guards up, assess the situation and how you're going to deal with it, and think about on an individual, so I don't know whether you're saying your wife is going to stay home. If your wife is staying home, then that's fine. So people who are shielding and staying at home, their family can go out and come back in, but they must be careful, right, when they're out. So if you're the one who's going out, how are you interacting with your colleagues, and when you're going to the supermarket, so you want to make sure that you're taking all the precautions so you don't bring it home. Okay. It's a pleasure, everybody.
Yeah, Dr. Noemi, there was one last question about blood testing. So it said, should all regular blood tests now include tests for COVID-19?
So we're not able to do that yet. Okay, we don't have the capacity to do that yet. People who are coming into hospital are all being tested, not on a blood test, but on a swab. And we've picked up, I've got a patient who's, I can't give too much detail because some of you know each other, but I've got a patient who on the face of it would think must be very high risk, and yet has been found to be positive from one of the swabs because of coming into hospital for something else. And she's been completely, absolutely fine with zero symptoms. So yeah, just as a reminder that not every, there'll be a lot of people with sickle cell disease who are getting mild symptoms. We're doing as much testing as we can, really.
Okay. I think that's all the questions we have, but thank you again so much, Dr. Noemi. That was really, brilliant.
Eat down on Friday night. And calories.
Exactly. And so everyone on the call, we will be able to share the recording of tonight's session with you, so you can watch that with friends, with family again, and just raise the awareness. We also wanted you to know that come the 19th of June, which is World Sickle Cell Day, we'll be having another event again, which wanted to let you know in advance. Today, we've been able to launch our website, so I'll just show you what it looks like. The web address is www.sicklecellawareness.org, and you can connect with us on our website and find more information on our website too. So there's a lot of work going on there. I'll share the link in the chat. And that is all we have for tonight. And thank you everyone for joining us. Really grateful that you were all able to make it tonight. Again, if what the work of this charity, is something that's of interest to you, please feel free to reach out to us. We need all the help that we can get. We need all the champions that we can get to promote the awareness of sickle cell and to take action on it. I think COVID-19 has given us a great opportunity to begin to push conversations further about sickle cell in all areas of the society. So thank you so much, everyone, for joining tonight. Thank you again, Dr. Noemi. It's always a pleasure. Thank you so much. All right, so everyone, enjoy the rest of your Friday evening. We wouldn't keep you much longer. Some of you have movies to watch, food to eat, family to be with. So have a wonderful, wonderful Friday evening, and we'll be in touch again with future events.
Thank you very much.
Thank you very much.
Thank you.
Thank you. Much appreciated.
Bye. Thank you.
Thank you.
Thank you. Thank you. Thank you, Doctor.
Bye.
Bye.
Bye.